If your partner is constantly complaining that your snoring is keeping them up at night, well, that snoring could be more than an annoying habit. Snoring could be a sign of something more serious. And joining me with more is Dr. Richard Berry and Dr. Beth Love, both with Lifetime Dental. And it's good to see you both again. Thank you.
Good to be here.
And as we were getting ready to discuss this, Dr. Berry goes, "Yep, I'm a snorer."
I am, and I was cured with the appliance, so my wife is very happy.
I'm sure she is, as other partners are too, and hopefully we're going to make a lot of people happy today. Beth, I said it could be more than an annoying habit. What could be a sign of snoring that means it could be something worse?
Well, snoring is the hallmark of symptom of sleep apnea, and sleep apnea usually starts on it's a continuum, and it can get worse as we age. That is one of the signs that we look for, is just age. Snoring, as it gets worse, it actually closes off the back of the throat. So it's if you're snoring loudly, there's probably an 80% chance that you have sleep apnea, which is a very potentially life-threatening disorder.
So snoring is a sign, and the louder or the longer, the more that you might be serious?
Absolutely.
I know that, Dr. Berry, snoring can be a sign with sleep apnea of other things. I mean, sleep apnea is kind of an indicator and could lead to other things. What are some of those things that could happen?
Well, there's a whole host of illnesses and serious problems and signs associated with sleep apnea. High blood pressure, heart disease, heart attack, stroke, diabetes. There's a whole list and litany of things that are associated with sleep apnea.
So you can't ignore it. Is that your advice? I mean, if you know that you have sleep apnea, Beth's shaking her head yes.
Yeah, you can't ignore it.
It is life-threatening.
It is why is it?
Well, if you have sleep apnea, your blood pressure goes up, you can have a more serious problem with incidence of stroke or heart attack, and there's a lot of research that indicates that.
You said that you had an appliance, and you brought it, actually,
I did.
which keeps you quiet, but also is something that people can have if they have sleep apnea.
That's right. If they come to our office, and we have to have a formal diagnosis, which
Hold it up a little higher. There you go.
Only a sleep physician can do. And once we have a formal diagnosis, they'll say, you're normal, or you're mild, moderate, or severe apneic. And so we can do different devices to help cure that problem.
Well, Beth, how do they work? I mean, you put them in your mouth. What does it do in order to stop the snoring?
Yeah, well, they're a very sophisticated oral appliance which advances the jaw and it pulls the tongue forward, and that opens up the airway so that air can get down into the lungs. Because what happens in sleep apnea is that you have repetitive episodes of partial or complete blockage of the upper airway.
So you're not getting oxygen sometimes.
Exactly.
That's what's happening, right? And so you're interrupting your REM sleep, you're not getting restorative sleep, and then all of those things affect all of these other things we were talking about with heart disease, of diabetes, stroke, of even things like sex drive and erectile dysfunction, and things that you don't even think about, that because your body is not restoring itself at night.
You're not getting good sleep.
You're not getting oxygen. Yeah,
and the amazing thing is there's some 40 million Americans who have this. And the unfortunate thing is 90% of the time it's undiagnosed and untreated. And this affects people of all ages, and it affects men more than women.
Do you feel better with your appliance now?
Oh, I do.
Yeah?
I do. I feel like I'm more restful. I used to fall asleep in the afternoon a little bit.
So that was an indicator, too, for folks, if you're sleeping during the day.
In fact, there's a big problem with that because a lot of people have car accidents because they fall asleep during the day and they're not alert.
You showed us your device. Are there other kind of devices, Beth, or is it just mainly that type? No, there's all different types of devices. There are some that just have elastic straps. There's some that are more, you can't adjust them as well. We use the ones that you can adjust because you have to titer that person and make sure that they are receiving the right amount of oxygen. They many times have to go back to the sleep medicine physicians and make sure that, and have the sleep tests done. You have to, the only way you can know for sure that you have sleep apnea is using a polysonogram, which is read by the sleep medicine.
So they get the test and then they come to you for the answer.
Exactly.
Yeah.
Exactly.
This has been very eye-opening. Thank you so much for sharing this.
You're welcome.